Hello, so today we will see a quick demo of MediLens. MediLens helps doctors in automated note taking while they're doing a patient consultation. So I'll play a demo video from YouTube of a doctor-patient consultation, and MediLens will start to take notes, and then we can see how that progresses. So I click on automated note taking. I start the video.
Okay.
The conversation.
I think I have an understanding about your current symptoms now. I'd like to move on to some questions about your past medical history, if that's okay.
Yeah, okay.
Firstly, have you had any major childhood illnesses?
I think I had chickenpox. I'm not sure really.
Just the illnesses which caused serious problems. For example, measles, mumps, whooping cough, rheumatic fever.
Oh, right, yeah. I had rheumatic fever as a child. I always have to have antibiotics before I have an operation or have any dental work done.
Yes, okay. So I'll make a note of that here. What about serious illnesses as an adult? Have you ever had TB?
No, never.
What about heart-related illnesses? Do you have high blood pressure?
No. My blood pressure is good, apparently. I always have to have it checked when I get a new pill prescription.
Okay. I'll ask about your medications in a minute, but I'll make a note of that now. No other heart problems? Have you ever had a chest pain or symptoms of a stroke?
No. I'm very careful with my heart because my father had a heart attack last year.
Right. We'll get to your family medical history in a moment. The other adult illnesses I need to know about are epilepsy or fitting of any type.
No.
Asthma or chronic breathing problems?
Yeah, I get a bit of asthma. I still smoke half a pack a day, but I'm trying to give up.
Uh-huh. How long have you been smoking?
Unfortunately, I took it up when I was a teenager. It must have been about 15. I was quite a heavy smoker until last year. I'm 23 now, so I've been a heavy smoker for 8 years. I started to cut back about 9 months ago.
That's good. It's hard, I know. Now,
Okay, we'll stop the video here. So what you see happening in MediLens is listening into the medical conversation that's happening, and it's picking up all the medically relevant information and creating case notes out of that. So you see all the medical conditions that were mentioned getting captured here. If there was any medication would have been discussed, it would have got captured here. Any tests and treatments, procedures are getting captured here, anatomies, and if any patient name was mentioned, it will get captured here. What the doctor then has is they can review the notes, and then if they don't want any information to be carried forward to the notes, they can press the cross here to remove that information. They can add any information they want to be added to the case notes by typing in here and clicking the plus sign. Similarly, for the medical conditions, the same thing can be done. Also, what you see is for all the medical conditions that are captured, there is a drop down here. So for each medical condition, because we are integrated into the ICD databases, the system is able to pull all the relevant medical database entries related to that specific medical condition and a kind of match based on the conversation that's happening, and the doctor can choose the most relevant or most appropriate medical conditions out of the different types of that medical condition in the case notes. Once the doctor is happy with the case notes, they can press review notes. Again, they get a chance to edit or add extra information here. So recommended rest for 7 days, which will be carried forward to the final summary. And once the summary is created, they can obviously see it in English, and if required, it can also be translated, for example, to any of these 30+ languages that are supported, including English, Arabic, major Indian languages, Chinese, and so on. So if they want to create a prescription in Arabic, they just press Arabic here, and the translated prescription will be created in Arabic. Let's go back to English, and then once the doctor is happy with this, they can print the prescription for the documentation of giving it to the patient, or export it to the medical record system. Thank you.